Welcome and thank you for joining the first of our ReThink Health Toolbox webinar series. My name is Maggie Cook and I'm a Senior Strategic Partnerships Associate with the Rippel Foundation. As we enter into this shared space, shared virtual space alongside one another, we hope you can take a moment to get settled in and grounded. Allow me to set the table we are gathered around today. The intent of the ReThink Health Toolbox webinar series is to help stewards drive transformative change by learning about ReThink Health's tools and resources. This series is one of many ways for us to build the movement towards thriving together, recognizing, of course, that none of us can do this alone. We have shared language around how this can be achieved, and it's through stewardship. This series is meant to share an introduction to mindsets, practical tools, and frameworks proven to drive deep, meaningful, and long-term change. And we are kicking it off today discussing the vital conditions for health and well-being. We'll share some examples of how we can bring these tools and practices from frameworks to action. And this is an opportunity to expand our collective network of stewards. I see a lot of friends here today and also many new faces. And we're honored to have all of you here. A few practical notes on norms. We encourage you all to share your questions and reflections in the chat as we go. There's a lot of us on the line today. We're going to do our best to address them as we can live. We'll also reserve the last 10 or 15 minutes of the hour for Q&A. We are recording this webinar, and both the recording and corresponding materials will be made available on our website. If you'd like to access closed captions or live transcription, we've enabled those functions, which you can initiate in the bottom ribbon of your screen. You should see the little CC icon with the caret next to it, where you can adjust your settings. If you have any questions about that, just feel free to message me in chat. We also encourage you to turn your camera on if possible. Take a look around the room and notice friends or even connections yet to be made. Learning with and from place is an honor. We acknowledge the unjust legacies we've inherited from forced displacement, resulting in physical and social fracture. We also know that for as long as this type of structural violence has been happening, people have been resisting in many ways, often in coalition, connecting across differences, be it region, class, background, and many others. The offices of the Rippel Foundation are Muncie, Lenape land, and it's important for us to consider the places where we all are and how we can best support the repair of traditional lifeways. For example, I'd encourage us all to learn more about how traditional ecological knowledge is being practiced right now in the places we are from, which is critical to the work of repair. Once again, today's webinar is an introduction to the vital conditions for health and well-being. Our speakers are Becky Payne, President and CEO of the Rippel Foundation, and Tiana Moore, Director of Systems Change. I'll first turn it over to Becky to kick us off with a quick poll.
Thank you so much for that welcome, Maggie, and thank you all for being with us. You can see the poll. Hopefully it's popped up in your Zoom screen. We would love to just further orient ourselves to how many of you have been exposed to the vital conditions prior to joining this webinar. Maybe some of you have had an opportunity to use the vital conditions in your practice. Hopefully these are simple questions for you. There's no right or wrong. It's just a way for us to know who's in the room. So if you could take a minute and hit submit after you click your selection, we'll see, Maggie can share, or we'll see the results of that poll pop up on our screen. Why don't we go ahead and see if we can close the poll. So we've got a good mix, and I'm pleased to see that many of you have at least been exposed to it in some way. Perhaps we've got some of you who were interested and curious. That's wonderful to hear as well. And many of you have not yet had a chance to implement this, or some of you have used it with limited application. You're in the right place. We're happy to have you. So if we want to go to the next slide, let me just spend a minute to orient ourselves to what this is and isn't as we get started. You all are joining us in the first in this series of wonderful webinars. I want to reflect on what it represents for us. This is about the beginning of laying a foundation with each of you in the things that we have learned over the last decade. That decade has been a commitment to action learning, to understand who engages in systems change. What are the strategies they employ? And of those who seem to have success and do so effectively, we've been really curious about how they go about doing that. This is not meant to be an intervention or present that any one tool is sufficient to affect systems change. And we fully recognize that strategies have to be tailored to local need and conditions. And you'll hear that throughout the series, and we hope you'll come back and join us. It is meant to lay a basic foundation and help all of us start to build a working shared vocabulary and bring into greater awareness for many of you the tools and frameworks that we use with our partners that we have observed to help support their pursuit of equitable systems transformation. It goes without saying, but it's worth being really clear. We know, and we know that you know, no webinar series is sufficient to solve our larger societal problems. That being said, I do want to talk about this unifying and measurable goal that we call our North Star. And it's important to talk about this and put the vital conditions in context, because as a framework, it is a very comprehensive, effective, and useful framework, but it is insufficient in and of itself. And it's important to know to what end. Why do we want to talk about vital conditions for equitable well-being? It's because we believe at Rippel, and we know we are joined by thousands of other change makers across the country and even globally, in this unifying vision and aspirational goal of a future where we see all people and places thriving with no exceptions. We do call this our North Star. We take it very seriously. We know that some people push back and say that sounds good, that's aspirational, but thriving isn't for everybody. And we reject that we really do pursue a future where thriving should be attainable to all. And right now, far too many are trapped in cycles of struggling and suffering. And we can understand that through multiple approaches, which you're going to see through the course of this series. The other thing we really like about this construct is that it is not just an aspirational goal, but it is also grounded in theory and offers us a wonderful measure of well-being that helps us start to tease apart what is the experience of many different groups in our communities, who is already thriving, and we need to support that to continue. But more importantly, when we anchor our work in equity and in pursuing systems change that addresses those barriers, how do we understand the experience of those who are struggling and suffering? The other piece about this being a measure is that we aren't the only ones who've been using this. If we look at this data over time, thanks to Gallup, they've been collecting this measure for many, many years. We see that it has some nice features. It is an immediately compelling way to orient yourself to understanding how people self-report their current situation related to thriving, struggling, and suffering. You can see through this very jagged time series, it's actually quite responsive to shifts in circumstance, whether they're economic, environmental, political, or even the steep drop that you see quite obviously during the pandemic. It also, I would offer, and we would offer, reflects an entirely unsatisfying ceiling in that we have never been able to break the barrier of more than 60% of Americans thriving. That means fully 40% of Americans report that they are either currently struggling or suffering. And so we must pose the question, what does it take for us as a society, as a collective, to reach even greater heights of well-being, in particular with equity and with an eye toward creating resilience? The benefit of having a group like Gallup collecting this data over time is that we're also able to look at different breakdowns of the data. So I know often when we're doing health and well-being work, we want to look at the disparities, and it's common and appropriate to look at that by race, ethnicity. You can see here that this data also reflects, parallels what we observe over time with health outcomes. The piece of this that is interesting, though, and for you to think about when you think about total community approaches, is it's a bit more sensitive to all the things that that produce a sense of well-being, especially when you look at that era on that top bar, when there was a set of positive role models in the White House. Our Black Americans reported a higher sense of thriving than their Hispanic and white counterparts. That's interesting. That starts to speak to a core element, which I'll talk about in a minute, about the vital conditions, about a sense of belonging. So you can use this as a wonderful addendum to our traditional health and social services data and get a much more rich sense of what's happening. The other thing is, when you really look at who's suffering in our communities, you see this quite steep uptick in recent years, which again validates the recent news cycle around isolation. You're seeing from the Surgeon General the uptick in poor mental health experiences and all of the data that's being reported around behavioral health and substance use. Next, I'd like to just say that because it is such a simple, next slide, please, such a simple measure, and it is 3 self-reported indices, we've seen local partners and coalitions use the same measure quite effectively. This is an example from a coalition of communities in the Fox Cities region of Wisconsin. You'll hear more about their story later from Tiana. They used this data along with other traditional health indices to really understand who is experiencing thriving, struggling, and suffering locally, and break it down in ways that were meaningful to them and the work that they were doing locally. And you'll see that they continue to use this and use it to inform their health improvement work going forward. So what does this all mean? Why am I orienting us to thriving, struggling, and suffering? It's really because we know that our well-being relies on a system that is not built for everyone to thrive. And this data brings that into stark reality. But we have observed through this last decade of studying these systems and who is doing this work, that we really do believe and have validation that those systems can be transformed if enough of us, and that means individuals and organizations across every sector, recognize their role and their power and see themselves and each other as interdependent. These systems get woven together when we come together in a broader movement for well-being, equity, and racial justice. But how does that happen? It can't happen by simply tweaking around the margins, as I would argue we often do in our program planning and intervention design work. We get trapped into designing narrow projects and relying on technical fixes that rest within an existing context and don't honor the legacies that have come and shaped the conditions we currently have. That's how we've produced today's results. No, in order to get different results, we have to think and act differently. And we have observed that the first step in successful systems change really requires first creating the conditions for a mindset shift around all of those community constituencies and decision makers who need to be a part of that conversation. That has to happen before we even start designing new interventions. So the vital conditions at their core are a foundational tool in helping to foster that mindset shift. Back in 2017, with support from the Robert Wood Johnson Foundation, our ReThink Health initiative came together with hundreds of national and local partners. You see some of their logos on this slide, to address a widely observed limitation of our practices at that time to make the kinds of gains we needed in order to address the social determinants of health. The result was an articulation of this set of vital conditions for health and well-being, which drew upon decades of research on social determinants, as well as strategic case making, and that's a really important difference. Now, some constituents were understandably reluctant to set aside their familiar social determinants of health talking points. However, the experience in using this framework presented an opportunity to see that those concerns were typically faded very quickly when they saw how well the vital conditions conveyed the core principles of social determinants, but it did so in a way that resonated with community residents and a broader range of allies outside of traditional health and social service sectors. This became immediately useful during the pandemic. I can say through my own personal experience, and Tiana will talk about this more, as it helped to explain how decades of failure to invest in the things that produce well-being, particularly equitable well-being, came into glaring obviousness to us all, and the interrelated nature of our economy, health, and well-being was reflected in the gross disparities, and traditional health approaches were entirely inadequate to respond to the needs of communities during the pandemic. I want to spend a minute going into a little more detail about the vital conditions. We'll stay on this slide and you'll have links to resources to be able to pull this framework into your space in the future. The vital conditions has some really important attributes and benchmarks. And often you'll see, if you've been exposed to it, you'll see the pretty wheel and the high level labels. And I think it can sometimes get confused as being a pretty framework and just a shift in terminology from social determinants of health. But it's really important to remember that origin story, that this was hundreds of partners really wrestling with, why are we not making more traction? What is needed to help us shift into a different mindset and actionable direction? So the vital conditions doesn't just talk about needing a thriving natural world or reliable transportation and acknowledge that those things are as much and more important to our health outcomes as access to healthcare. It sets standards and benchmarks and articulates a set of attributes for each of those vital conditions that need to be present in order to foster well-being. So housing is a huge topic. I think it is receiving the attention that it has always deserved in the link to fostering well-being and stability for families. And the vital conditions would validate that it's not just about access to housing. It's not just about consistent housing. It needs to be humane. And there are specific attributes of that get articulated in this. Adequate space per person, the safety of the structures, the affordability, the fact that they're in neighborhoods that are diverse, that don't fall into the downsides of gentrification that result in segregation and concentrated poverty. And then it starts to draw the through line to the other vital conditions, because it also talks about the need for humane housing, to have proximity to work, school, food, recreation, and nature. So you start to see how these are not just siloed chunks to be worked on independently by one sector or one agency, that you really can't deny how progress in one can foster progress in another. The other thing that's really special and important to understand about this framework, I'll spend just a minute on belonging and civic muscle. You see it at the center, at the heart, if you will, of the framework by design. That's because belonging and civic muscle is one of 7 vital conditions, but it has an outsized impact and role. We have dynamic models that show that an investment in belonging and civic muscle has an outsized impact over time on the rest of the outcomes. It is also a practical capacity that, if built and invested in, has an impact on how equitable the design of the remaining 6 vital conditions would be. Now, don't be confused that this is about a seat at the table for historically marginalized populations. This is about making sure that communities and specific populations within communities really have a sense that they belong, that they are not just invited to one conversation, but that their community fosters a sense of capacity and outlet and power to shape a common future and a different legacy going forward. So the capacity and belonging in civic muscle, often we find, is as much about creating the capacity for traditional leaders, those who hold positional power, to build their muscle, to hold space in a meaningful way, for those who have been creatively coming up with solutions to take care of themselves and their neighbors and their family for some time, because they've been trapped outside of those systems. So belonging in civic muscle, you really need to understand and embrace that it is central to the whole framework, and it is critically important if you're going to anchor your work in equity. The last thing I want to say is that, again, acknowledging that one framework alone is entirely insufficient, it's important to recognize and honor the fact that the vital conditions exist in a trajectory over time. We would talk about that as our legacies. So we can chart a path forward. As I mentioned, these systems that exist were created by people. We are all people. So people have the power to perpetuate legacies, and we have the power to understand, heal through the history of injustice, and transform to a different legacy going forward. So the vital conditions in and of themselves are critically important. We inherit them when we start off in the world, and I think social determinants of health do a really good job of pointing that out. It also is important to recognize that when we get into close coordination and collaboration and meaningful engagement with each other, together we have the capacity to transform that future and create a different set of conditions. And we often pose to our partners, if you think about your future generations, how are we making choices today that set us up to be good ancestors for generations to come? Lastly, I want to end by addressing sometimes what's the elephant in the room. I've talked about it a little bit. We often get a question about how does this relate to social determinants of health? Is it in conflict with social determinants of health? Are you trying to displace the social determinants of health? Again, I would remind you of how this started, and the answer is a resounding no. We really see the two as compatible and working together. The current vital conditions framework renders the essential elements of social determinants of health into a form that is clear, concise, and built for concerted action. It creates hope and starts to chart a path with those benchmarks of what do we need to do, how do we need to design for a future that achieves the end goal in mind. The other thing we have really learned from our partners who have worked with the framework on the ground in regions across the country is that it communicates in simple, humane language with priorities that are easy to remember. It helps people build consensus around things that are familiar, both conditions and values, and it's optimistic and focuses on the benefits we want to create, not the harms we hope to avoid. It also helps us move beyond a false dichotomy of health versus healthcare. And it reveals how multiple conditions fit together as a system to show how anyone brings a piece of the solution. And I'll offer that when we align with the things we traditionally invest in, when we align the vital conditions with the things we traditionally invest in this well-being portfolio that you see on the right, those things that we often refer to as the urgent services, those are the things that you see a rush toward in times of crisis. And then we continue to maintain those investments in urgent services. They're necessary, they're important, but you can never invest your way out of crisis and into thriving if you stay focused on urgent services. So we find putting this portfolio together, showing that those are choices we get to make, helps to, again, change mindsets, open eyes, and foster conversations where we say we need to maintain an adequate level of urgent services, but the only way to foster thriving and a more equitable future is to also have conversations about how can we shift investments and commitments over time to invest more in the vital conditions. The result is, when we have these times of crisis, which are a part of our current reality and future, we will have less reliance on those urgent services going forward. So I know we've thrown a lot of content. We're going to get into some stories and sort of how this plays out in the real world in a minute, but I would love to just invite other voices into the room or into the chat. If you have questions, it doesn't have to be a response to what's on the screen, but if there are any questions, I'll invite folks to come off mute or raise your hand, but coming off mute and just being brave enough to speak is also helpful. We can't always see all the hands that are raised. So what's resonating, what might be confusing, or if not, we could maybe get some chat around where you might be seeing use of the vital conditions, even if you didn't call them that beforehand, and where you might be seeing opportunities for more intentional collaboration across sectors and partners. I know I've got really wonderful experts in the room who worked with us and worked with the vital conditions. I would invite them to share.
Becky, this is Kathy Carr from Tampa, Florida. I'm wondering how we might be able to build the infrastructure in healthcare. We've been talking about it for eons, forever, in terms of it's not what it should be. The infrastructure isn't there, and when we have crises, which of course we have crises all the time, it's redundant dollars going into healthcare where they might have been, as you were talking about earlier, diverted to making other areas more sustainable through time. So in healthcare, how can we shore up that infrastructure in terms of you're not paying for the same thing over and over and over again?
Yeah, thank you for that question, Kathy. And it's such a complex question and a complex answer. So I'm going to just caveat, I can't possibly do it justice right now. But I would offer that I think one of the things we've observed in working with healthcare systems, and I have members of the team who've done this work extensively, is we see the goodwill and the true desire to address equity. I think that's how we often see that manifest, and wanting to do right by patients. I think we need to remember we all share common aims. We bring different tools and experiences to how we approach that. One of the things that we observe is that it's unfortunate that those conversations get trapped inside of healthcare. And so the question we would offer is, how do you expand and set a broader definition of what infrastructure or foundation are we starting with? And is the role of hospitals to, for example, address every social need? Should they be in the business of housing? Should they be in the business of food pantries? How do they actually use their leverage, their standing, their voice, their tremendous role in communities of influence to actually call other parts of society to the table to share in that? And so I guess it's sort of, this is the mindset shift we talk about, which is we would get into conversation with you and start to get curious about that. Whose infrastructure? Who's weighing in on that? Who's a part of that conversation? What do we need to do the case making to bring them along so that then the solution set looks a little bit different going forward? I see Paula has come off mute.
Yeah, is it okay if I pop in? I see a couple other people have hands on. Okay. Yeah. Hi, folks. I'm Paula Morgan with ThedaCare Health System in the Fox Cities, and we're one of the communities, I guess, that's probably been using the vital conditions maybe a little bit longer than some others. But with respect to hospitals and how our hospitals might be using this, we used my hospital system use the vital conditions in our community health needs assessment work. So we actually took a look at our data by vital condition, along with additional data. I mean, host of other burden of disease data, mental health and well-being data. And when we posed the question to the community after, in our community conversations that we hosted with folks from, very diverse sectors of our community and diverse representation, toward the end of looking at all of our data, we posed the question to the community about, for decades now, we've been putting money into maybe the fixer-up stuff, which I usually call it, the adverse services, and or we try to put money into there's a certain core few things that we know are risk factors for a lot of chronic disease, things like smoking or diet and education, and we're falling flat on those. It's just not working. So we posed the question to the community in each of our 8 different markets about, what mix, where should we focus our energies at what mix? How much should we focus our energies on those same things we've been working on, trying to change the behaviors versus trying to even get further upstream in the vital conditions for health and well-being. So hopefully you're impacting those behaviors even a little bit more downstream. And all of our communities having that dialogue, it was like a 75-80%. They wanted to focus on the vital conditions because they got the fact that we can't urgent service our way out of the health crisis that we're in today. So it stood us up for a great conversation. And I know Jason Chulis and some others from this area called the Fox Cities, this large area, we've used the vital conditions in a variety of other ways as well.
Thanks so much, Paula. You did a wonderful tease for one of the stories we're going to share shortly. So I so appreciate that. Fernando, I'm going to go ahead and ask you you've had your hand up for a long time, and others, I'm going to ask you to maybe share your question in the chat or hold it. We're going to try to hold some time for the end. We love seeing this engagement. We just weren't sure what to expect with the first webinar. I don't want to tamp it down, but I also want to move into the next section. And then, like I said, hopefully we'll have some time at the end. But Fernando, what's your offer or question or contribution?
Thank you, Becky. I appreciate it. Fernando Trotter with the Bureau of Bronx Neighborhood Health, part of the New York City Department of Health. And I've been working on numerous disasters before COVID. And I was actually able to get some of our colleagues in the Department of Health to consider adopting the vital conditions as part of a just and equitable recovery for COVID. But part of the problems that we keep running into, particularly when it comes to belonging and civic muscle, is how do you measure it? What are the metrics that you could use to justify designing a program around it? How do you provide a case for the work to say that these things should be invested in, as opposed to continuing to deliver services that have diminishing value and end up costing more in the long run? And so this is part of the challenge that I have. I get a lot more pushback because of how fuzzy the concept is, as opposed to like, hey, let's do this, let's elevate community voices and so forth. So any recommendations with regards to metrics or with regards to best ways to measure it, quantitatively or qualitatively?
Yeah, Fernando, thank you for that question. And I'm going to say yes, and we will follow up. But for everyone on the call, we have partners at the Institute for People, Place, and Prosperity, IP3, who have, and I think my colleagues are dropping things in the chat around some of these issues for further reading. We also would love to have further conversation with you just to talk that through. We're happy to do that. But I would also offer a couple of things, and then I'm going to hand it to Tiana because her first example speaks a little bit to this. I would share with your colleagues that you're not the first to think about this. Measures do exist. And for those who don't know, prior to joining Rippel, I spent 20 years in the federal government. My last position was helping to lead the work that Tiana is going to talk about in a moment. The federal government has now also signaled that the status quo was wholly insufficient and contributed to the disparities we witnessed in the pandemic. And so the federal government has now come out with a plan. One of the recommendations is that all agencies adopt the vital conditions to structure their planning. Now, that's a huge bureaucracy that has to change, but I think you can use that as validation that the federal resources that flow, the approaches to best practices, et cetera, are also, the signals are coming from the federal systems to align with the vital conditions. And we hope to arm you in the course of this series with other examples. You'll see a map in a minute of the many places that are also doing. But please, we will reach out to you for further follow-up. All right, we could probably spend another hour just doing this, which we would love, but I'm going to hand it off to Tiana because we know that the power of stories and hearing from others like you who are doing this work is far more compelling than hearing just from us. So Tiana.
Thank you, Becky. Next slide, please. So given the work that we do at a national level, Rippel Foundation, we have the privilege of not only seeing, but helping to influence efforts towards health and well-being. We see it as manifesting in ways that move long-standing institutions, such as the federal government entities, away from business as usual to a new way of working across silos, right? Looking beyond immediate needs, the urgent services that Becky mentioned, toward longer-term improvements to health and well-being. A recent example of this, as Becky spoke to just now, is the release of the federal plan for equitable long-term recovery and resilience. The impetus behind the federal plan was the glaring fragility of our systems brought to light to broader constituents through the COVID-19 pandemic. The development of the federal plan entailed a multi-departmental, multi-agency effort across the federal government landscape to identify and address the root cause of system failures, which is obviously no small task. In delving into this work, an interagency work group reviewed a number of constructs and ultimately adopted the vital conditions as their organizing framework. It provided the actionable organizing structure for building connections and alignment across all federal government entities represented. By working from the strengths-based vital conditions framework, the work group had a blueprint for identifying problems and identifying a total of 78 proposed recommendations that were categorized across each vital condition. So a quick example of how the federal government is taking a stance on the vital conditions is to increase the use of vital conditions framework and federal resources by employing the vital conditions for health and well-being framework to advance strategic planning, regulation advancements, and initiative development across the federal government. Next slide, please. So moving beyond national efforts, I'd like to share how this shows up locally on both the community and regional level, where we know a lot of innovation, right, takes shape. So before diving into these examples, I'd like to note that the ways in which these communities and regions show up as stewards and put the vital conditions in practice, it looks different based on the needs of each community, but it's often rooted in opening up dialogue and centering belonging, civic muscle in all that they do. This slide is a snapshot of our close partners across the nation who have not only adopted the vital conditions, but are also bringing it to light through specific and innovative practices. And as an example, I'm going to give you a glimpse into Imagine Fox Cities in Wisconsin. Next slide, please. So Fox Cities was formerly well known for the nation's largest paper mill industry, but in the early 2000s, there was a shift. Their industry took a decline, but the shift did not only stop there. It carried over into what the community looked like, an increase in Black and Brown families from what was formerly a predominantly white community. But Fox Cities, they faced this new reality and decided to invest in the future of their community and its well-being through a series of dialogues over a course of 8 months. They gathered data by measuring the well-being of their communities, as you see in the chart to the left. And the photo on the right is from one of their dialogues held at a local library, and it takes a peek into what this process was like. And as you can see on the walls, they were filled with substantial feedback. Next slide, please. So Fox Cities, they really aim to create a sense of belonging for all of their community. And one unique way that our friends in Fox Cities invested and enhanced their belonging and civic muscle was through belonging through art. And it was an initiative asking local artists to further the message of belonging through mural and sculpture art throughout the Fox Cities. This initiative embraced all the creativity, and their community and helped to foster and instill a shared sense of belonging. Next slide, please. So Fox Cities, they took a look ahead, right? And imagine the community, the kind of community that they wanted. And this slide shows their pillars. The first one, where kids get off to a strong start and onto a positive life pathway, which means anchoring the importance of their lifelong learning through access to quality schools that foster their intellectual, emotional, and social skills. Fox Cities really has a rich and diverse community, but they had to bring those different voices to the forefront and emphasize, again, the important factor is that they were intentional about centering belonging. Next slide, please. Another example of how Fox Cities is showing up in their community is through community health action teams. They call them CHAT. Bringing together leaders from multiple sectors to co-create innovative solutions for positive systemic change across the various vital conditions. And so these leaders include government, public health, business, education, healthcare, philanthropy, and even faith, and many others. Part of the CHAT experience includes a day-long field trip that allows the community leaders to not only see and hear, but learn from those who live in the different parts of their shared community and whose lives are impacted through the insufficiency of our systems. These community plunges are thematic, and they don't just stop at these trips, right? They go beyond that and have deeper conversations, all to result in solutions for all who call Fox Cities a home. To date, 4 of the regional health systems and the 5 health departments are all using the vital conditions to organize their community health improvement plans. The commitment to belonging is ensuring that their planning is more deeply anchored in community voices and more likely to advance their equity goals. Fox Cities has truly been an exemplar of what it looks like to invest in the vital conditions. Next slide, please. So when you internalize the vital conditions framework, it's easy to see bright spots in other areas as well, right? As you're thinking about things, it's much easier to say, oh, wow, now I actually see this, it connects the dots. And so I'd like to share another story of an exemplar from the field in Omaha, Nebraska, the Operation Youth Success Initiative. They're investing in vital conditions in a way that specifically reaches young males of color. So we know youth and young adults, they shape today and our future, right? They hold the key to open endless opportunities ahead. So whether you're a parent, a teacher, or a mentor, we all recognize the importance of the vital condition lifelong learning, and that it's continuous, but it begins at birth. I'd like to make note, you'll see who's the bringing together who, the dynamic, how diverse the cast of partners are in this initiative that they brought together to solve this issue. So not just juvenile justice leaders, but family court judges, school officials, police officers, and also community organizers. Far too often, males of color, especially with learning disabilities, go overlooked in the education system and are stigmatized because their needs are not fully supported or misconstrued. Misbehaving in the classroom, unable to communicate, refusing to participate or do work are all actions that lead to expulsion, suspension, and discipline that works against their strengths and further deepens the challenges they already face outside of the school walls, resulting in school to prison pipeline. Next slide, please. So by working together to prevent youth from becoming another statistic of the juvenile justice system and instead keeping them in school or supporting probation-involved youth as they return to school, innovative initiatives like Operation Youth Success can support a trajectory of lifelong learning for young men of color, which also correlates to the greater likelihood for meaningful work and the wealth as another vital condition. And of course, the hope is that engaging the leaders who are there to support, as opposed to punishing them, can help these young men feel seen and cared for, therefore speaking to their need for belonging. So you'll notice the quote to the right on this slide, and it's from Chris Rogers. He's Douglas County Commissioner. And so Chris has served in this role since 2005 or so, when I was able to find, and has consistently made a stance about seeking to advance a new era of equity and progress in Omaha, Douglas County, and the surrounding metropolitan area. And what I love most about this quote is the acknowledgement that they are still building trust with the community and families and system stakeholders who feel like they could be doing more to change the juvenile justice system and produce positive results for their community. So the act of building trust, it speaks to one of the many ways communities address the heart of the vital conditions, belonging, and civic muscle. So I'll turn it over to you, Maggie.
Thanks, Tiana. Before we move on to the Q&A portion of our time together, let's take a few moments to recap what we've heard today. The feedback we've received from partners is that the vital conditions provide a unifying, hopeful, and actionable framework. As we grow our own awareness of how the vital conditions framework can be applied across many sectors, we gain the opportunity to think more deeply about how to tailor tools and practices to our local needs and conditions, as we've seen in the many examples cited today. Each of us can continue to incorporate this mindset by thinking in terms of vital conditions and examining the ways in which we bring this to action. For example, advocating for more concerted community collaboration and investment using this guiding framework. In a future webinar down the road a little bit, we'll introduce exercises to build regional well-being portfolios. So it's just one component of the deeper company work ReThink Health does alongside our partners. But how do we embrace interdependence? How do we describe how we show up? As my colleague Bobby Milstein says, we don't just mean in terms of conventional leadership. We think of it in terms of stewardship. Stewards are people and organizations who work with others to create conditions that everyone needs to thrive together, beginning with those who are struggling and suffering. Our next webinar will be an introduction to shared stewardship, so please keep a lookout in your email for the coming save the date. Now we'd like to open it up for Q&A. Please feel free to unmute yourselves and share your observations, reactions, or questions. There's a lot of activity in the chat, so
Maggie, while people are thinking or summoning up the courage to come off mute, I'll just call out a couple of things. Lloyd Michener, who we all love and adore from North Carolina, raised a really good point about, in his experience, based on the local reality there, some of the terminology has been helpful and some of the terminology would have been a barrier. So they tailored how they were using the language. And I want to be really clear that we support that. We learn from those experiences and we absolutely advocate for you making this real, that it's the end goal that's most important. And we offer this to you as a way to have a starting point, but you should definitely make it your own. The other thing I'll say is that we do find that with more time, and when we get into close partnership with communities and we've been with them over a period of time, they often report that the language, the terminology was challenging at first, but then on the far end of their evaluations, they often report that the vocabulary, the new frameworks, the help them shift mindsets were some of the most valuable assets of the experience of going through this process. And so I think there is a way to do that dance, start with where people are and bring them along over time.
Does this framework help you consider anything differently than before? Would anyone like to share one thing that's really standing out to you? Solomon, go ahead.
Hi, yes. My name is Solomon. I'm currently in Philadelphia. I'm part of the investment fund interning. And I just really want to say that I really enjoyed this presentation. And I recently just graduated from Temple with my bachelor in community development.
Congratulations.
Thank you. One of the things that has always been important to me is definitely building more equitable communities. And the thing that really stood out to me, I really enjoyed the diagram that had the circles with all the different components of thriving with a natural world and basic needs and humane housing and really creating sustainable communities for people to thrive in. But one of the things that I guess I really wanted to know, I had a couple questions where maybe just regarding some ideas you guys might have about how do we go about building trust amongst residents in their communities, and then how do we promote meaningful work and education within our communities? Because what I find is that for a lot of people who live in low income communities, there's less access to fresher foods and less access to higher paying jobs because of the lack of education. And then also too, I think that what's really important within communities is having that trust and really being able to have that sense of belonging, as you were saying. Because what's important is that when people share the same values and ideas, they're able to thrive. And so I just wanted to kind of get your ideas on how you would approach that.
Well, first, let me add congratulations. We need folks like you in the field doing this work. So, congratulations on your degree and the work you're setting about to continue doing. Trust is such an important piece. It is the most basic brick in the foundation of doing this work. And I think it's a tangled web in communities that is different depending on where you are. So I want to acknowledge that first. But I would offer you a couple of things. The first may feel discouraging, but I think it's important to speak truth about what this takes. And that is that trust is not built at the speed of a budget cycle. It's not built at the speed of an election cycle. And so I think Paula actually very eloquently spoke to the courageous choice that leaders made there, not just in Theta Care, but in the Fox Cities region, to say, you know what, we can go about this in very traditional ways. We can have our usual conversations, and we might even have, I would say, traditional kind of community forums where we have an hour or two a couple of times and invite community members in to talk to us. That's not trust producing. That's at a minimum, at best, it's status quo, and it's often very trust eroding. So I think the hard, honest answer to your question is that in order to embark on this work in meaningful ways, you really have to be clear about the fact that this takes time, that it is about doing things fundamentally differently. And I would pose the question, whether you're able to, given your role in the community, or you have other champions and mentors who can help you do it, to say, what we've been doing clearly isn't working. And if we want a different outcome, we at least owe it to ourselves to question if what we're proposing is it's not going to do harm. We know it won't do harm, and it probably has a high likelihood of setting us on a different path. So why wouldn't we try it? The trust then really, I think, anchoring into that belonging and civic muscle component of the framework in ways that are enduring, in ways that are genuine, and really helping your traditional leaders have the capacity to sit with what they're hearing in the community, to genuinely believe the experiences that they're being shown. This is why that anchoring in legacies is so important, because you can't build trust if you don't honor the experience that the community members are sharing with you. If you don't really go back and say, it's not just about the food insecurity or the housing insecurity of the last 6 months or the last 6 years. It is about a trajectory that was generations in the making that our community has created, or the communities from which you came created, that set you and your family on a path to be experiencing what you are experiencing now. And now I want to understand what the role is of our broader community and all of the sectors that need to come together to help change that trajectory going forward. But it really is a long-term commitment, both in listening and sitting with each other and thinking through solutions. And it has to be a long-term commitment to suspend the need for near-term metrics and outcomes. That's the conversation that is the starting point. I see we have a hand up with Caroline, I'm sorry.
That's okay. It's actually Caroline, no problem. So I work in Washington State. We have several teammates on the call today, and our board has adopted the vital conditions as a unifying framework for our region, which is very large and very rural. So somebody asked a question about that in the chat, and I have questions, and there's areas where we feel stuck, and I'm not necessarily gonna, expect you to give us an answer today, but maybe in future webinars. What we're struggling with is how to roll this out across an incredibly large region where some of our partners already have a framework and they already have a portfolio. And so you don't want to erode trust by stomping on what's already there, but you want to have a unifying framework. And then the scale of it too. It's like, do you hold conversations really hyper locally? And then the more you do that, you start to see patterns that emerge regionally. Like, that's the part we're scratching our heads on. And I'm wondering whether Fox cities had similar challenges, since I think they covered multiple counties and cities. So I would love to understand, like, how did you actually do this? What did it look like?
Paula, do you feel like you can answer that?
Yeah, and I know Jason's on too. I don't know, Jason, if you'd like to take a first crack at that, or?
Yeah, I could take a quick crack if you can hear me okay, because I'm in a car.
Yep, we can.
Yep. So we basically focused on 19 communities within 3 counties. And what we did is we were broadly using a survey. And so that survey was brought to those communities. And we also did a 88 community conversations across different groups from those communities, so that we could hear from the voices across the communities and across various demographics. In addition, in the second time we ran the survey, Theta Care expanded kind of the survey region. So there was a region for the 19 communities, but there was also beyond that, which really focused a little bit more on the rural area. So that might be a good pass to you, Paula, to maybe talk about how that was used to support kind of the greater area than the 19 communities.
Right. I think the measurement that we did gave us a talking points to be able to put in front of the leadership of those communities. The other thing I'll say is I do think all this conversation about common language is really important. And we early on in this process with Imagine Fox Cities had some significant community leader organizations involved and adopted this as well, like United Way, Community Foundation, a couple other health organizations in the community, so that these are the folks that are in that space a lot in our community with us. And if we are talking the same language, it makes it a little bit easier to get that adopted by others, and at least curious. That opens the door to have more of those conversations.
One other quick note, as we were doing surveys, we noticed, for example, that African American males were low in our survey area. So we worked with the local barbershops to get hand surveys into hands of African American males to also allow us to make sure that we were hitting all the demographics in our community.
I don't think I should even approach trying to top answers from folks who've really been on the ground doing this work. Paula and Jason, thank you for sharing. Any last question or comment, perspective? Again, fully acknowledge an hour webinar for what is normally a half day to a day workshop set in the context of multiple days and months with partners doesn't begin to do it justice, but we really appreciate everyone's interest and are eager to hear who wants to learn more. We'd happy to connect back with any of you.
Yes, and if everyone could just take a moment, it's a very brief survey. We've dropped the link in the chat. Your feedback is very helpful. Let us know what worked well, what we could improve. Really appreciate seeing all of you here today, participating, engaging. Thank you for your time.
Hi, I had one more quick question for Becky.
Happy to stay on for anybody who wants to linger. But thank you all. And Maggie, thank you for kicking us off and stewarding this whole work.
My pleasure.
So I wanted to ask, how do you combat the problem of social isolation with regards to trying to improve the vital conditions? Because social isolation is prevalent. It's probably the #1 killer of people worldwide.
Yeah. And I'm sure you've seen the Surgeon General's advisory recently that came out on just that point. I actually, full disclosure, I've been rattling around on this morning, honestly, somewhat maybe anticipating we might get this question. And I'm not sure where. So how do we combat social isolation? I think it's a community-wide effort. I don't think that it hasn't grown to the proportions that it currently is with having really viable, strong solution sets. So I think we need to acknowledge that. We don't know at a level that is capable of going to scale yet. I'm sure there are bright spots that exist that we need to find. That said, I was actually really, for some reason, sitting with this current dialogue that's happening around social isolation and the work that Dr. Murthy has done to shine a light on a really important problem. And I'm wrestling in my head with, does talking about it in the way that it's currently being discussed still keep it anchored in a very individual, socially isolating solution set? In other words, I think some of the ways it's still being discussed runs the risk of kind of telling us it's a bootstrap solution, that people need to be able to get themselves out of social isolation. And I think that to me really only validated why belonging is at the heart of this framework for us, why it's so important. And that is to say that while it's an individual experience, it is actually a community-wide phenomenon, and the solutions really need to come from the whole community embracing the importance and the urgency of it and creating a set of conditions and interventions that bring people out of that isolation. But I'm just a little bit worried in the current discourse that's happening that it's still being framed as largely individual type solutions to kind of snap yourself out of it. But I would anchor us back into belonging as a really compelling approach, that there are pockets of our communities who really go about day to day and don't see the assets of the community as being for them or reflecting people like them or reflecting what they need. They, for a whole host of reasons that are not their fault, don't feel like they can access those resources. And so for those of us who pay attention to that and have the privilege of designing some of those services and solutions, what does that mean? What does that lack of sense of belonging tell us about what we need to do differently? But so I don't have a good answer, but I do think that when community members see groups like what happened in Fox Cities, Palm Beach County is another good example. We have a number of good bright spots. There's a lot of work happening in the Northwest. When they see community leaders saying, I recognize that all of society has a role to play and we're going to take this on in a meaningful way, I do think that starts to create a little bit of a glimmer of trust and curiosity, but it's a long, protracted problem. And there are many of you who have stayed on the line, so if somebody has experience with something more concrete to offer to Fernando, I would welcome your voice into this. And Fernando, I know you asked if we can connect and if we do presentations. We absolutely do. Rippel's kind of spread all over, but we're actually based in New Jersey. So, and you've got a number of our team members right there in New York City. So we're happy to connect and have conversation with you.
Thank you.
There is the Othering and Belonging Institute does some really good work here, as well as Stanford Design wrote a book called Design for Belonging. And so that's another great place to look for practices.
Thank you, Jason. And Bobby has also dropped a few links, which we will share all the links from the chat with everybody.
Hey, Becky and Maggie. This is Carlton from Wilmington Alliance. Great presentations today, and definitely looking forward to working more alongside with you. We provide wraparound services for marginalized communities, so this is like right in alignment with the work that we do. I've personally never used the terminology vital conditions, but it makes sense. So yeah, everything was very in alignment as I was listening to. So definitely looking forward to having some further dialogue and connections with you guys. I did fill out the survey, made sure I put my email in there so that we can connect to further advance this work in our area. So we're in Wilmington, Delaware. So look forward to continuing working with you.
Thank you so much for being here today and for your feedback. Believe me, we take it heartfelt.
Yeah.
Absolutely. Great job, guys. Take care.
Thank you so much.
Thank you. Well, we are at time, so I'm going to give people permission to sign off if they'd like. And again, a few of us will hang out for a few more minutes in case there are any other questions, or you can use the survey to get back in touch and follow up.
Hi there, I'm Sarah Pickford. I'm based in Northern Virginia. And I just kind of wanted to ask you guys, I put this in the survey, but since you're hanging on, might as well ask, how would you recommend addressing people who are kind of more traditional leaders, and how this can be somewhat threatening or perhaps anxiety producing when it kind of goes against some of what they've built their entire careers around? And they do have lived experience and knowledge in working with some of the larger systems that it can be tricky to do. So I understand there needs to be a balance between kind of more non-traditional community-based leadership as well as the more traditional kinds of established leadership.
Yeah, I'm seeing lots of gestures and head nods. So I'm going to first see if anybody else, Sarah or Lisa, I'm not calling you out, but if you want to respond to that, please feel free. If it was
I
just a
feel
vote of
like
yes,
this
I
might
have the
need
same
its
question. That's
yeah,
okay too.
this might need its own like presentation, because
Yeah.
I do think, you know, if people aren't already on the bandwagon, I can see there being some like hesitancy to jump on this, even though
Yeah.
I think it's
Well,
great.
yes and no. I would offer, we are very intentionally transpartisan, and that's really important. One of our really core central tenets is that we don't see the world as a zero-sum place, that there is abundance that is at our disposal if we choose to think differently. And you can't do that if you stay on the poles of discourse and division. So, you know, again, in an hour, we can only get into so much, but there really is an anchoring in that value of there is something to be brought in from every perspective. That's the whole point of the belonging piece. Because I think there are folks who come from traditional backgrounds and settings who also feel that they're othered, that they're on the sidelines, that they're on the margins right now. So the other thing I would just say is Fox Cities, who I wish Paula or Jason were still on, and happy to put you in contact with them. That's actually a very traditionally conservative, historically white community and region in Wisconsin. And so there's no reason one would go into that region thinking we're going to bring a super progressive or liberal approach, and that's the point. So it really came down to how they entered into the space. They didn't presuppose the outcome, which is, again, we don't tell you what the right mix of vital conditions versus urgent services are. We don't come in with a presupposed assumption about the legacies that exist in your community. But what we do is help you understand how important it is to be curious about that, how important it is to genuinely set a table that embraces lots of perspective. And I think for some of us who come up in social services and community development and public health, we tend to set a table that is not truly neutral, that is not transpartisan. And so this is about not just making the case for folks who we wish would agree with us, but holding up our own mirror and honestly setting a table with the right conditions that builds trust among all of those partners and constituents. I'm actually really proud of the fact that many of the partners that we've worked with represent regions that you might not traditionally think would be doing this work. We certainly have examples where it is more what you're describing, but when we get into deeper conversation with you, that's kind of where we start. I should say the team, I can't take credit for this, but the team really starts with wanting to be really curious and kind of interrogate you on who are your partners, what is the landscape of the network in your region, what do they all represent, what are the stakes, how do you engage with them, who's going to be skeptical, who's going to be a ready ally. And that's really where this whole capacity around strategic case making also gets really important, so that we help you, and again, we really help you, it's not us, enter into the space in a way that honors what everybody can bring and makes the case in ways that don't set up those boomerang reactions, but really genuinely imparts that this is about trying to do problem solving in a fundamentally different way, because what we've been doing just doesn't work. It's not what we've been doing, what you've been doing, none of it has worked. So it's time to start over. And starting over requires all of us to enter the space in a really different way.
Do you have resources for case making? It's something I've heard you talk about a couple times in this presentation.
Yeah, and it's probably one of the topics we will do a webinar on.
Okay.
We do.
Very prescient of you, Sarah.
Yeah.
I was like, maybe everybody else knows this term and it's just not something I'm familiar with.
And we can't take credit. We have been educated about strategic case making from a woman named Dr. Tiffany Manuel. Dr. T, as we call her. So I'm looking at you, Bobby. I don't know if you're still hanging on in the chat, but if somebody can drop that resource, or Sarah, we can also include it in follow-up in the links
that'd be
that we
great.
provide. Yeah, we've been talking about doing some work to refresh that toolkit on strategic case making. Thank you, Bobby.
Oh, there it is. Thank you.
I
I appreciate that.
Yeah. Well, thank you all. It's very, it warms my heart to have you all hanging on this long, and also to see that this resonated with so many. And we just appreciate the work that you all are doing on the front lines.